Mhm.
All right. Let's let people start to trickle in, the
Coming in, yeah.
attendees. All right. So, welcome everybody to the official start of day 2 of the Ganson Congress. The theme of advancing access to therapies in IBD, inherited blood disorders. I'm going to introduce our lovely moderator, Dr. Annette Akintente. She is located in Nigeria, and she is going to start the show. So, without further ado, please take over.
Hmm. Thank you so much, Sam. Thank you. Can you hear me? I'm assuming I'm audible, right?
Yes, you are.
I'm checking. Okay, good. Good morning, everyone. Good morning, good afternoon, good evening. That's what we do now in these virtual meetings from wherever you are around the world, because we're able to come together because of technology. Thanks to technology, I'm really glad that we're here. I'm privileged really to be part of this, and thankful to Gansid for making this happen. Today is day 2, and we're part of the regional sessions. Okay, and today, we're privileged really to have with us Dr. Andrew Zapfel, who I'll introduce later. He'll be talking to us about a very critical topic that we are all so and very close to our chests. All right, and but first off, let me just go through some housekeeping issues that are very important to ensure that we have a seamless and enjoyable session. Importantly, let's note that this session is recorded. So if we want to refer back to it or tell others who have not been part of this to be able to enjoy it, they can always go to the website inheritedblood-disorders.world and access the recording. So down to housekeeping. We're going to take questions, but I'm sure we're all burning. We're going to be burning with questions by the time this session is going through. But right, you see the Q&A feature, and at the bottom of your screen, put your questions down there. On the other hand, you could raise your hand, and then I will be able to see you, hopefully, and call on you. But otherwise, the chat or the Q&A features are good for questions. And then please note that your microphones will be on mute so that we don't disturb the train of thoughts of our speaker, and please bear with us for that. Interestingly, and I'm very pleased about this translation captioning provided by Ganset, by the organizers. And this is a very rare feature. I don't see it often in webinars. So you are able to listen to the webinar in the language of your choice. And the way to access it at the bottom of your screen, you will see you can click on show caption. Show caption. If you click on that, it takes you to enable translation. So you can pick the language of your choice. That way you can follow without really racking your head to understand the English. Okay, and then let's remember to be respectful in terms of the language we use in our chats, in our questions. Again, like remember I said, we want to enjoy the session. It's so important. This topic we're talking about today is very important. The entire Congress is so important. This is our day 2. Yesterday was a success. Let's make today a success also. Um, um, Again, we're going to keep our questions and everything related to the topic. The poll will come up, a poll, P-O-L-L, towards the end of the session. It will be put up by Sam, our able guy at the back there. And just to answer the questions, it's going to help us make this, the Congress better and better as we go on. And today's topic, remember, is what? We're still on capacity building, project management. Project management, new tips and tools. It is so important. I know that. And I know also from experience that this is a topic we kind of approach with some level of trepidation. I know that myself over the years when I was a younger doctor and through the years with project management, but especially the M&E aspects, the monitoring and evaluation, what is so important, particularly when you're getting funding from grants and sponsors, you need to be able to be sure that the monies you get, every single penny goes down to the project you're doing. And I thank God for Gansit for making this available to us, accessible. I'm very happy because if we're going to pay for this, we'll pay an arm and a leg. So thank you, Gansit. I'm going to introduce very quickly our very able Dr. Andrew Zapfel. He was here yesterday and did an excellent job, but I'll still introduce him. We're privileged to have Dr. Andrew Zapfel. He will be breaking down the subject from supply chain management to stakeholder engagement and everything in between. Andrew Zapfel is a seasoned global health and human rights professional with over a decade of experience in international development. He's currently the Senior Manager of International Programs and Alliances at the American Society of Hematology, ASH. Zapfel has worked with diverse organizations, including the United Nations Joint Program on HIV/AIDS. His expertise spans health system strengthening, policy advocacy, and governance, particularly in countries in Africa, Kenya and South Africa, and even West Africa, and also Afghanistan. Zapfel's work is deeply rooted in his commitment to advancing health equity and human rights on a global scale. He's also an adjunct instructor at George Washington University. Please join me in welcoming the eclectic Dr. Andrew Zapfel. Andrew, please, over to you.
Thank you so much. It's wonderful to have that introduction. It's nice to hear. Thank you so much, Doctor, for your nice words and great way of starting the session. I do want to first, before we begin, announce that I am not a doctor yet. I am going to be starting a PhD program next year. So hopefully soon your words will become reality, Doctor, in terms of myself. So I look forward to that. But thank you all so much. And thank you so much to the organizers, Gansid, for hosting this capacity building workshop. I know for the agenda, we've seen so many great sessions already on inherited blood disorders, on all those issues and so forth. And this session is a little bit unique in that, well, we've learned so much on the technical skills needed to advance our causes around inherited blood disorders. My focus will be on how to best ensure strategic planning and project management skills can be best adapted to organizations of different sizes. So excited to go through this today with you all. I also want to just special thank you to Gansid as well, because I know it is quite early in Canada and I know it's quite early. I'm currently in India for the Indian Society of Hematology's annual meeting. So today is it's a better time for me at the moment, but definitely want to thank the organizers so much for having this event and definitely making it accessible to many different parts of the world. I also just want to add too, before we get started, feel free as always to, if you want to start entering in information in the chat, I'd love to hear where people are from around the world. So definitely introduce yourselves in the chat, say where you're from. And if you do have any questions during the session, definitely feel free to ask. I'm happy to kind of adapt this as best needed. If you want me to go slower, go faster, whatever needed, I'm happy to make the session as useful as possible. So with that, let's go ahead and get started. So already I was kind of shared a bit about my background, but I want to make sure I also share kind of why the focus this day is on project management. So through my work with the American Society of Hematology, particularly implementing with a host of experts from around the world, we have the Consortium on Newborn Screening in Africa, or CONSA. I'll talk more about that in a second. Also, one of my major projects is the World Coalition on Sickle Cell Disease, which is an entity made up a public-private partnership dedicated and focused on advocacy and engagement at higher levels of governments as well as United Nations to prioritize sickle cell disease as a public health burden, particularly in sub-Saharan Africa and India as well, where I'm currently today working with different stakeholders on advancing the causes of sickle cell in India. I do have a project management professional certification, and I'm always happy to talk more about that. If anyone wants to meet one-on-one to learn more about that, happy to share what that means. And I'll be using a lot of the tools and resources that come from that PMP to advance strategic planning as well as project management. So with that, I just want to talk a bit about the projects again I'm working on and why I'm invested and very passionate about inherited blood disorders with background also in HIV and other topics. So as I mentioned, the Consortium on Newborn Screening in Africa, or CONSA, is an American Society of Hematology initiative. Its goal to demonstrate the effectiveness of laboratory-based newborn screening and early intervention services in 7 African countries. As you can see on the map on the right, we have clinical sites located in Ghana, Liberia, Nigeria, and West Africa, and in East Africa, Kenya, Uganda, Tanzania, and Zambia. This work was initiated in 2020, But over since 2018, actually, there was a lot of work done by stakeholders and many of our global experts, as well as experts in these countries, to develop the plan in place to implement Kanza. And so we've had a lot of success over the years. Over 100,000 babies have been screened, 1,500 diagnosed with sickle cell disease. And we're making inroads and working with national stakeholders and governments to sustain these efforts. Because overall, as we implement projects, as we implement programs, and think about strategic planning to best implement the work we do, we always want to think about sustainability. How can these work continue ongoing efforts after our initial investments? So just want to share a little bit about my interest, my background in the cause. A lot of my focus right now and my day-to-day job is really focused on sickle cell disease. So a lot of the examples I will share throughout this presentation might mostly focus on that, but I promise I'll do my best to make sure it is as useful and adaptable to other inherited blood disorders as well. What's interesting about Kanza, though, too, and as mentioned by a doctor, is really the scope of the project here. And what I like about Kanza and what's been very fascinating about this work is the different areas that we've had to work in with stakeholders in country as well as globally to implement this massive project. And that includes, as mentioned, supply chain management with supplies coming from Finland, from South Africa, from the United States, as other parts of the world as well. We've had to create those supply chains to get the necessary supplies for screening and diagnosis. A lot of capacity building work in terms of laboratory and clinical capacity to do newborn screening, grant management, technical monitoring evaluation, and stakeholder engagement. So all these activities have come up in this project, and I'll use some as examples as we walk through strategic planning and project management. But just wanted to kind of share a bit more about, every project is going to be so diverse, but a lot of different skills are needed, and really look forward to working with you all on this today. So what is project management? So while the focus is going to be on strategic planning, I think the two topics are very much aligned and very much in sync in what is necessary in terms of skills and capacity to best achieve an effective strategic plan as well as effective project management. So project management is defined by the project management professional organization. What I really like is the discipline to bring together resources, achieve specific goals within defined scope, time, and cost constraints. And we're going to spend a lot of time on all of these key areas here because I think each section each of the areas I've highlighted are so critical to best understand how to effectively implement any project or strategic plan. So they mentioned, as we're going to go through that, a lot of today's topics will be on discipline, which I really think it's critical that we talk about the discipline needed to effectively do the work that we want to do. Because any type of project we want to implement in inherited blood disorders, in resource settings, or anywhere really, require commitment. It really takes a person with strong will and dedication to begin the idea of planning and implementing a project of any size. It requires patience because no one works alone. We all work in collaboration with our own colleagues at our office, at organizations that we work with other stakeholders, with governments, public health professionals, and more are all needed to make sure any project is successful. We can't control anyone, so we have to have patience and due diligence there. And critical thinking. And again, this will come up a lot in the presentation, is making sure that not only are we thinking about what are the needs of communities, what are the problems that need to be addressed, but also prioritizing those issues and also relating how those prioritizations link at the capacity of an organization to achieve what you want to achieve. Resources, of course, anything costs money, it costs time, it costs staffing and budgets, and community time is needed. So you really want to make sure you're thinking about engaging all different stakeholders and what kind of resources will be needed to achieve what you want to set out to do. You want to make sure you are developing goals that can be feasibly accomplished. The scope, and you know what the project is, and scope is one of the favorite words in project management. And any people who work in this know well the scope idea is what is it actually you want to set out to achieve and do. Now, sometimes what happens is as we develop this scope and we know, okay, here's the barriers, here's the boundaries of what we're setting out to do with the resources and time that we have, and we want to do it effectively. So we have these barriers in place. We're going to do these objectives, and that's what we're going to set out to do. Sometimes people start going, well, can you do this too? Or maybe we want to add this, or maybe we can do it in a faster time. and your scope starts to change. It becomes bigger, it becomes faster because it wants to be done cleaner, but maybe your resources don't change and the quality starts to get impacted. That's called scope creep, and we'll talk more about that, but necessary to really define the scope of what you want to do in terms of strategic plan in any project. Timeline, we'll talk a lot about that as well. You're setting designated times and when you want things to be done. And remember, the big thing about projects, and the one thing we always say is in project management, is every project has to have an end date. If it doesn't, then it's not a project. It's a program. It's an idea. It's an activity. It's something that's going to continue on forever. That's fine. But projects do have to have an end date because we do want to set aside that time to learn what went well and what didn't, and then develop the next project, the next program, next thing that we want to do to help achieve our overall mission, vision, and goals. And of course, cost constraints. And this is also linked to the critical thinking I mentioned earlier, is need to know what financial resources are needed to achieve your activities and what limits you. Because again, we know that not every organization, most organizations don't have unlimited resources. We don't have just someone we can say, oh, please just give us millions of US dollars, please, immediately. We know that it's going to take grant writing, grant applications, management, and so forth. And so we need to know what our capacity is to achieve the objectives we want to do, and at the same time know where we might be able to get those resources and what feasibly are the amount of resources we can get given the size and capacity of our organization. And I really want to start with this, is what is your timeline? And I want to make sure everyone knows that when it comes to strategic planning, when it comes to project management, everything can and should be adaptable. Nothing is set in stone that you need to do strategic plans a certain way. No, not every organization needs to do a 5-year strategic plan or a 10-year strategic plan. Maybe if you're brand new, you've just created an organization, you've just figured out your mission and vision, what you want to set out to do, it might be more viable to do a 6-month strategic plan where you're thinking through, okay, here's what we can reasonably accomplish and I can hold myself accountable to doing over the next 6 months. Then it's a year after that. Maybe then it's 2 years. I currently am on a board of a nonprofit in Washington, D.C., where I'm usually based. And we're just currently going through now a 2-year plan because we realize we have the capacity, we have the knowledge, we know what's going to happen likely the next 2 years and what we think we can feasibly do. That makes more sense than a 5-year plan or a 10-year plan. So I always like to say, as we get started on this kind of journey through strategic planning and project management, that every organization needs to think about their own timelines and their own feasible ability to implement what they want to set out to do. So let's talk a little bit about the comparisons between project management and strategic plan development. And there's a lot of similarities between the two, some slight changes and differences. But again, as we already talked about, just kind of ways of reiterating the points here, project management includes discipline to bring together resources, achieve those goals, define scope, and identify time and cost constraints, knowing that there's going to always be those concerns there. Strategic planning, though, on that side, though, includes goal setting and vision creation, environmental analysis, understanding the context of the situation you're working in, strategy formulation. So once you've done that, you're able to now identify your key priorities and how you're going to set out to do so. But also, any strategic plan includes implementation and monitoring. And this was brought up earlier in the introduction. But any strategic plan can be written. We can write anything and say we can accomplish anything as organizations, and then we can print the document, put it on a shelf somewhere, and call it a day and never look at it again for 5 years. The reality is, though, that any effective strategic plan has to include how you plan on implementing the objectives that you are setting out to do, and how you're going to hold yourself accountable with an effective monitoring and evaluation approach. And we're going to talk more about that, including some tools and resources to develop that, including the logical framework. So again, here, the kind of buckets, if you will, of setting goals and developing a strategic plan is including the analysis, community engagement, defining the problem, identifying achievable solutions, and then developing that plan itself. And I don't want anyone to think that it's going to be the step approach where you do the analysis, engage the community, define problem, identify achievable solutions, and it's going to be an easy step-by-step approach. It never is. Oftentimes when we were doing analysis and we think, okay, we're defining the problems, and you realize, wait, I don't think we understand the problem effectively yet. Let's go back and do more research or engage more stakeholders or interview more people. Maybe once you're identifying achievable solutions for your organization, you realize, I don't think we know this issue well enough yet. Or maybe we're identifying the wrong problem here, given our own capacity as an organization to do things. So we have to go back. So again, these are the kind of buckets here. We love to think that it's an easy path from analysis to a plan development, but it's never the case. And no organization should feel that this should be a very quick and easy process to do to develop a strategic plan. But we are going to start delving into all of these areas too. Before we do, though, and I mentioned community engagement earlier, I want to focus on this. I like this picture here about the importance of community and the importance of engaging multiple stakeholders. Community engagement is so vital in the work we're doing in inherited blood disorders. And, I come from a background working in HIV. And for decades, the HIV response has always had a mantra when it comes to people living with HIV and those caregivers of people living with HIV, is that nothing about us without us. And it's a mantra used by other organizations, by other marginalized communities, and those seeking better health equity around the world. Is nothing about us without us, is that any plan, project, activity needs to include community in not only implementation, but planning, development, as well as monitoring and holding all of ourselves accountable to achieving what we wanted to set out to achieve. So I think it's so important that always in the background of our minds, always as we're thinking about any activity or project we want to do, we're thinking about how the community can be engaged. And the community can mean multiple different things. Can include persons living with inherited blood disorders, can include their caregivers, can include other community-based organizations. And I'll show you a slide in a little bit of an exercise we like to do to kind of mark that. But really, it's so critical that as always we're implementing this work, we're engaging broad stakeholders. This is going to come up a few more times in this presentation. One way is a tool here that we like to use for engagement strategy. And just to note, everyone, I'm very open to sharing these slides with everyone. So don't feel like you need to copy and paste these tools. They'll all be readily available for you. But when we're thinking about stakeholders, usually the activity we like to do internally in organizations or with a small group working on a strategic plan is to first just completely brainstorm all of the stakeholders you plan on working with as an organization to achieve what you want to do. And it just takes, maybe 5, 10 minutes, maybe 15 minutes for discussion afterwards. Having everyone just on a big white paper in a room, just list every organization you work with, community-based organizations, ministries of health, ministries of education, healthcare providers, health facilities, maybe community health workers, just list off all of those different groups that you work with. And once you've listed all of them off, taking a minute and then using this chart here to kind of pinpoint where those stakeholders lie in terms of engagement. Now, what happens here in this orange box in the top left, those are people who have high influence, but maybe don't have as much, sorry about that. Not much as interest, if you will. So there are people who have high influence, but low interest. These usually could be people like the Minister of Health. Minister of Health has a lot of sway in terms of where resources go, where programming goes, where focus on and attention is given and awareness is raised on disease topics. But because they have multiple different diseases to focus on, multiple different issues to work on, things come up daily for them, they might not be always able to care about the disease that you're focused on or the work on inherited blood disorders. So you might put them up there. Now, of course, they could move. Maybe that minister is really engaged and interested. But for the most part, we know ministers of health are usually quite busy. On the top right here, are the very important stakeholders, those who you're going to work with really closely, those who have high influence and high interest. And maybe that is, if you're looking more at the regional level, you're working with the tertiary hospital and the sickle cell clinic, if you will. The doctors there, the nurses there are clearly very interested in this effort. And maybe they're high up doctors as well and have a lot of influence in how the hospital can move resources around or support some of your projects or programs. So those are someone you might want to have high interest, high influence and manage more closely. In the bottom right are those who are heavily interested, but maybe not have as much influence there. Again, they're not like that they don't matter, but maybe they don't have the ability to make the change that you might need to see to sustainably continue the work moving forward. And then finally, you have monitor in the bottom here. And again, that's why we say no stakeholder is negative. We don't want to push anyone aside or ignore them. But these are the people with low influence, low interest, who may at some point change. They could grow in influence or stature. They might start to show more interest. But those are ones you might just monitor, and maybe they're not going to be heavily involved in your programs. You're inviting them to all of your events, but you're still going to make sure they're informed, they're aware, maybe through social media, maybe through a newsletter, to continue the work moving forward. And here is just an example used, I say for Ghana, using this as an example here, where we have different stakeholders listed: ministers of health, the Ghana Health Service, local NGOs, skipping down here a bit, local media outlets, academic institutions, community leaders. And as you can see here, we started to rank a little bit about their interest, how interested they are, their influence as well, and their position on the matrix here. And again, this is something that every organization might have different thoughts or feelings on of where they should be located. But having that sort of base and framework of understanding your stakeholders will go a long way in then being able to dictate, as you start identifying the problem and coming up with solutions, how to engage people most effectively in the work you're going to set out to do. And the next, as we're thinking about the analysis too, analysis comes from looking at the research, looking at news, looking at what's been done before. You're going to start seeing and notifying certain trends and activities. And this is where the problem tree comes into play, a really useful tool in getting us to understanding the problems, the root, the trunk, if you will, the main problem, and the causes itself. And here is just a blank form here, but looking at here as an example. Whereas you've been doing research and talking to stakeholders, talking to people living with inherited blood disorders, caregivers, and more, you're recognizing some key issues are coming up. Hey, I have not received my diagnosis or my children's diagnosis of a disease for a long time. Oh my God, healthcare costs keep increasing and my wage does not meet the needs of the healthcare costs. In the area that we work in, there's high morbidity or high mortality from our inherited blood disorders, or generally there's a reduced quality of life. So you're starting to pick up these key trends here in your analysis. Well, then you want to start doing, okay, well, what's causing all of this? What's leading to delayed diagnosis, increased broader healthcare costs or long-term healthcare costs, higher morbidity, mortality? Well, then you start noticing here, problem right here, inadequate newborn screening services. And stakeholders are telling us, if we had a way of having scaled up newborn screening, had more children having access to that and getting linked to care immediately, we could see diagnoses moving faster and lower morbidity and mortality. And so great, that's awesome. But then you then are seeing that's the problem, inadequate newborn screening services. Well, what's causing that? And that's where you want to go deeper. And again, as I mentioned earlier with that critical thinking, we don't want to just end on the problem, but really go deeper in what's causing that problem. And that includes things like limited healthcare infrastructure or capacity, insufficient funding to buy the resources, the reagents, or other tools needed to do diagnosis, lack of training, so engaging healthcare providers more deeply, or low public awareness or education. People don't know newborn screening is available or are not seeing it as a necessary tool in public health and their broader care of their children. So as you see here, we went from, okay, here's identifying some trends or what people are seeing. We're linking it to this problem here on inadequate newborn screening services. But then we're going to go deeper as well and looking at some of the causes here. And then once you've done that, what you can do is turn this now into a solution tree, because that's going to help you shift the discourse from here's the problem, someone should solve it for me, to here's the solutions, here's what we can do to address these problems. Now, as you see, it's sometimes just a matter of changing the language. We want to decrease healthcare costs. We want to increase early diagnosis. We want to reduce morbidity and mortality. And that's going to come from comprehensive and effective newborn screening services that are widely available and accessible. Look, a vision right there in itself in getting you closer to your strategic plan or your projects. And to get to there, though, you want to look at some of these strategies around policy system reform, public engagement and education, strengthening training programs, or advocacy for increased investment. And now I really want to delve into this area too about achievable solutions, if you will. Because as you see here, there's multiple things an organization could do to focus on and involve in their strategic plan. But you want to make sure it's achievable for your organization. And that's really requires you to take a important, deep, and honest look at the skills of your organization, the capacity, and the resources that you have. The best way, I say, are these 3 questions to see what we should be doing as an organization to address this problem that we're seeing. One is, does this align with my organization's mission? Of course, everything we do has to involve our mission and vision. And the organization should already have that. If not, they should really make sure they develop that before moving forward with a strategic plan or any projects. Because if you don't have that mission or vision, you'll jump at anything. You'll do any activity. And then that's going to make donors, grantors, and others a bit confused and concerned over what is that you really are trying to set out to achieve and how does this all link to the skills that you have. The second question is, does our staff have the capacity to do this? Again, maybe you're too busy. Maybe you think that you could do one activity, but realizing your staff's capacity is more aligned with education or outreach or engagement. Maybe you don't have a laboratory, so you might not be able to do some of the newborn screening, but that's where you might want to work with stakeholders. So does our staff have the capacity to do this? And 3 was, would we require outside resources to make this happen? And do we have the relationships to do this? So yes, we want to do this. It's going to cost X amount of dollars. Do we have this in the bank? Or do we need to write a grant, seek out partnerships or sponsorships, and how to do that? And can we do that well? So I feel like these 3 questions can really start you in that direction of achievable solutions. And we go to that because as we go back to this problem tree, many organizations are good, and I've seen this a lot of times, is that a small community-based organization or a new organization goes, oh, there's inadequate newborn screening services. We're going to do a project to do newborn screening. We want to pilot newborn screening in these clinics, and we're going to make that happen. And then the question comes about from reviewers, organizations that might be willing or have the funding or resources to provide grants and opportunities go, you're a small organization. You don't have a lab. You don't have any clinicians on your staff. Where's the laboratory staff? We're a little confused here why you think you can do a pilot on newborn screening, when most likely these organizations that have the resources to sponsor might go, you're giving us more of a realization that if your organization wants to involve public awareness and education, great, we can fund that. You want to be involved in training healthcare providers on the importance of newborn screening, great, that sounds wonderful. You want to do more advocacy activities, great. That's where you might want to prioritize the work that you want to do, given the capacity of your organization, rather than try to achieve a higher problem that might need more stakeholders and more follow through. So this is what is something that, again, why critical thinking is so important and it's so valuable to do, is because taking that extra step of realizing insufficient funding and advocacy is needed, training is needed, that's where you can really find a nice sweet spot for your organization to do, versus trying to maybe promise or say they can do something maybe outside of your capacity. So it's important to do that. And as we're developing the plan, again, scope, as we've talked about, what will your project set out to do? When would you like to accomplish this? And the resources needed to make it happen. Again, I like to always just reiterate as I'm going through. Now, here's the big thing. After your mission and vision, and you divide the problems, and you're seeing what the kind of causes are of those problems, and now you're really just set forward on a path to doing programs, activities, and so forth, you want to develop smart objectives. And I'm sure many of you on the call have seen this before. I think it's one of the most useful tools possible in strategic planning. It's always useful to reiterate, is when you're developing the objectives of a strategic plan, a project, you want to make sure they're smart. They are specific, they are measurable, attainable, relevant, and time-based or time-bound. Sometimes it's also referred to as. And what we mean by that is, if your objective is, we're going to do newborn screening in this region of the country. Okay, well, it's maybe a little bit more specific because you're saying per country, but we're going to do newborn screening. Does that mean for universal screening? So all babies born, well, your goal is to do that. Does this mean how many sites are you going to do? I'm not sure yet. So you might want to prioritize that a bit more. Measurable, again, how would I be able to know that you've accomplished this objective? Maybe, again, as we're saying more about raising awareness, we're going to host 5 radio spots or have 5 radio talk show engagements in the next 6 months to raise awareness on newborn screening. Great. 5 radio talk shows. If you've shown me the 5 radio talk shows, you've recordings, great, you've done that. It's measurable. Attainable, again, as we talk about that critical thinking, can you accomplish this? Is this possible to do? with the resources you have. Relevant, again, is it linked to your mission and vision? Can it be possibly done? And of course, time-based as well, because again, as I mentioned, things want to have a set end date, and it's important for yourself to hold yourself accountable to do so. Now that's the SMART tool. Now I always like to add additional ones for those who are in the United States, or maybe you've seen this candy before. They're called Smarties. They're just really sugary, like little tiny things. But anyway, the idea now is we like to add I and E to SMART development. So SMART-E, if you will. And that includes goals need to be inclusive and equitable. So as you're developing your SMART goals, specific, measurable, achievable, relevant, and time-bound, you're now also including, is it inclusive? Have I engaged diverse community members in the development of these SMART objectives? Is it going to be useful to diverse members of the community as well? Maybe, thinking if we're doing things solo or inside a small box, or maybe just by ourselves, and we're not being inclusive, then are we really actually achieving like what's going to be most impactful for the community? And next, of course, is equitable as well. Are the most marginalized at the table? Are the people who we're trying to make sure achieve the healthcare that they need, the groups that we want to improve their access and improve their human rights, are they involved? Are they going to be able to see a change in their circumstances? And that's the equitable approach here. I think these additional questions to any SMART objective just further refines and also gives you more information, more tools, so that when grantors or agencies want to ask you, where is this all going to go, you have those answers ready to go. So I think it's really important to add IE now to SMART objective development. I think it's really useful, and hopefully you include it as well. And then finally, acknowledging the resources needed. Again, really important as you're developing these objectives, these plans, and these activities. You want to think about what are the essentials needed to make this project a success. That includes computers, printing, internet costs, staff time, catering, engagement. Those are some things that are really important to think about as you're developing any project or plan. And then you want to compare that to what you currently have in terms of resources. So maybe you already have computers, you already have staff that can do this, et cetera, and so forth. And then once you have that difference here of what we need to have and what we do have, then you have your budget, if you will, almost, or kind of the resources you might need to go for sponsorship or grants. But also I'd say it's always important then to add that padding, if you will, or what are some of the risks that might come up that we may need to plan for? Will these risks cost funding? Maybe if you want to host a community event where you're going to raise awareness, is there going to be, and it rains that day and you have to cancel it and move to another day? Is it going to cost a bit more to move that appointment or reservation on the land that you're using? Maybe it will. So you might want to think about adding some padding as well to make sure that you're not stuck if something happens outside of your control. And I think this is the last tool we're going to use today. And this is this is moving in more into monitoring and evaluation of projects, strategic plans, and activities. It's called the logical framework. And I think this is not only a really useful tool in monitoring evaluation, but really useful tool when it comes to the eventual writing of a grant and including the narrative, if you will, to stakeholders or sponsors on how best to implement. And so looking at this logical framework, it's a very basic chart here, just 5 columns. We have input, activities, output, outcomes, and impact. And what do all of this mean? Well, as we go through, looking down here, input is what do you bring to the project? What are the skills, the resources, the manpower, the people you have that will be able to bring in so you can do this project or plans. The activities are then what you will actually do itself. And we have some examples soon. And this is where we start getting to the monitoring evaluation side is your output. These are the initial measures that you can say you can prove that you've done your activities. These are usually numbers and quantitative measurements, and I'll give you some examples in a little bit. Next level is outcome, is what do you hope to achieve? So what are kind of changes in behavior, changes in knowledge? Those are where you start looking at the outcome here because that's different higher level data that can still be collected by an organization semi-easily, sometimes a bit more rigorous depending on the needs, but can still be done. And then the impact here is how do you hope to change the work being done in your city, your region, or your country, if you will? These are usually much harder to evaluate. And also you might not have the sole influence on a change happening there. But in a theory of change, if you will, and looking at logical next steps, if you achieve what you hope to achieve, you believe an impact will be made in the country or region you're working in. So assumptions are, what do you believe will happen? Those are really important too, and we'll take some examples there. And then some risks. What do you need to be careful of? Again, every project, every plan, every activity has some risks associated with it. It's better to think about them now and have plans ready to mitigate them versus waiting for them to actually happen, and then you're wondering what to do next. So here's an example. So looking back at our raising awareness example and needing to get more people interested and knowledgeable about newborn screening or testing or diagnosis for your inherited blood disorder. So this idea here is, yes, the project is we want to raise awareness. And by doing so, we're going to thinking about, okay, what are our inputs? Well, we have staff, we have hospital that are ready to be and willing to be a part of this because they have testing equipment and they want to be involved. We have healthcare professionals who are interested in talking and sharing their expertise. We have persons living with disease who want to talk about their experiences, the importance of testing and reducing stigma and misinformation. We have community volunteers who are also ready to go and support. In order to raise awareness, though, what are our activities? We're going to have 5 radio addresses on this disease. We're going to host 3 community art events. I made an art event just to make it a bit more fun. But the idea here is these 2 activities are what you want to set to do. And then your outputs, again, as I said, are the numbers, if you will. So number of radio addresses done, number of community art events, number of people who attended these events, number of community members who have been engaged. Those are numbers you can easily collect from these activities because you just go, oh, here's 30 people in the room for this community event. Here's the recording of the radio address we did on our disease. Great, you have that recorded and ready. So anyone asks, did you actually do that? Yes, here's the stats we have to show that we did that. Now, the outcome, though, is when you want to maybe do different evaluation tools or methods to showcase that you've accomplished something. That might include increasing knowledge on the disease among the general community, reducing misinformation as well. And now you measure that by maybe doing surveys of people who've attended your events and ask them afterwards, what knowledge did you gain from this event? What changed? And I'm always happy to provide any tools that have been developed or work with anyone on those evaluation methods. Maybe the radio addresses, you also do a survey of how many people listened in, if that kind of information is available, maybe via YouTube or other internet platforms. Yes, increasing knowledge on the disease too. And then finally, the impact would be improving testing and retention and care. Again, maybe hard for your organization to measure that effectively, but if you can measure that you've successfully implemented these activities by having the radio addresses and having the community art events, you do some surveys to show some change in knowledge or people sharing quotes or behavioral change, any grantor or funder would be more than happy with the work that you've done. And then finally, looking at assumptions, we think the radio address will host the informational sessions. We're going to assume that they will. And of course, we assume people will listen to the radio addresses. But again, we probably have collected some information. We know that people do have these stations on. They listen to them regularly. And risk may be ensuring accurate information is presented. Again, so how do we mitigate that? Well, the organization is going to develop talking points for anyone who joins the radio addresses. So they will stick to a script maybe. Maybe they do different ways of thinking through that. And the need to address when events can and should happen. Of course, we know that things happen, storms happen, maybe some events have to be canceled or postponed. But again, you'll be ready to go because you've thought about it ahead of time. So again, if you have all this information now written here, now imagine how easy it is to take this information, and when you have to then write the grant application, including a narrative that might have to be several pages, you have all the information right here. All you need to do is then add more language and add more sentences to kind of explain it more in detail. But it's going to make it so much easier to turn this into a grant than trying to write a grant on a blank piece of paper. The last thing I'm going to land on, then I'm going to give some time for questions, is the triangle of constraints. This is a major project management professional tool that's had some updates over the past few years. And as we can see here, the major areas initially of the triangle of constraints for any project or strategic plan were scope, cost, and time. And because, of course, everything we want to do is quality. We want to have a quality product, we want a quality project, we want quality activities done by any organizations. But when you change and cost, maybe you lose some funding or don't have enough funding, and your scope and time stay the same, well, quality will be decreased. Maybe your scope starts to creep a bit and you're adding more activities that you didn't mean to initially, but your costs have stayed the same and your time has stayed the same. Well, then again, the quality will be reduced. But what's changed a lot in the past few years is recognizing that it's not only scope, time, and cost that are important, but resources, risks, and quality as well are all integral. And anytime you need to improve or change any of the one of these six, you need to factor in the others as well. If you promise a donor, oh, we said we could do 3 webinars in the next 3 months. Actually, you're right, we could do 5. Well, if they don't change your resources, thinking now about, okay, what are the costs associated with an extra 2 webinars? What time do we need to add now to create effective webinars that are going to be informational and going to bring people together? What are some risks associated with that? Because maybe the staff are going to be too busy. And now all of this means that quality might suffer a little bit. And again, all of these are really important. As I mentioned, saying a deadline has moved up in terms of time. Well, again, resources are going to go down in terms of how much time your team has, what equipment can be available, your risks in terms of things happening badly or quality being a negative might change, and your scope might also need to change as well. I think we're at a good time here, so I want to skip ahead a little bit and just finish on some final points here. And again, when thinking about strategic planning or project management, as always, you want to look at your timeline here. And again, if you're thinking 10 years in the future, you want to maybe go big. And you think you have the ability to go big in 10 years to to create a new clinic or to ensure newborn screening is implemented everywhere or what have you. Sure. But many organizations might not have that capacity yet. You're new, you're trying to figure out what exactly is your niche or area of capacity that's going to help influence the response to these inherited blood disorders. So maybe your focus is on 6 months or 1 year, maybe as much as 2 years as well. Again, there's no set rhyme or reason or no set dictation on what you need to do, but it's just important for your organization to think of what makes the most sense for you. And remember the importance of discipline as well. Strategic planning, project management take time. They take energy and they take resources. If you do it too quickly, you will not have a quality product that you can use to guide your efforts. It'll lead to more burnout. It'll lead to people looking at different things, agreeing to different things that fit outside your mission and vision. But discipline is so critical here. And I always take things one step at a time. And I work for the American Society of Hematology. Something we share regularly internally is we like to walk before we can run. Rather than agree to do everything and try to jump into activities that we think are useful, we want to walk first and let's take a few steps first. Let's bring stakeholders together. Let's see where the needs are. Let's see if we're the right fit in terms of implementing this project. And as always, you want to start first by identifying the problems, the root causes, assess capacity of your organization and other stakeholders, and develop those feasible SMART strategic plans. I want to end on this slide. Here's my email address, my LinkedIn. I'm always happy to connect with people in different ways or talk more about project management or learn more about the work. I invite you to check out the World Coalition on Sickle Cell Disease and looking at the focus and priorities we have to advocate at the UN and national levels to scale up sickle cell testing and clinical care. I definitely thank you all so much for your time and listening in, and I'm happy to take any questions now. But thank you so much for listening. Yeah, I'll stop here.
Wow, wow, wow. Thank you, Andrew. Thank you, thank you. I said that you're going to break it down for us in ways that we can understand. Thank you very much indeed. And I'm so sure that everyone across here, all participants are listening in with very rapt attention. I know you have your questions now. And remember, I said you can put your questions in the Q&A or even the chat box. You're free to do so, and I'll take the questions quickly for you. But really, thank you, Andrew. What jumped out to me, where I have one question if I have time to put it in, but really the idea of discipline is key. You emphasize that so much, and I agree. So let's hold that, as we say in our own climes, in our left hand, so we don't throw it away. Thank you. Discipline is key. Commitment. If we're not serious about it, we're not going to go far. Commitment and dedication. Then the fact that's the community engagement strategy, that matrix is in our minds now, and I think we're going to deploy it and use it all the time. then the concept of achievable solutions. We should know ourselves. Know thyself. What can we really achieve? So let's keep that in mind. And I like the idea that we have SMART. Now everybody knows SMART, but we have added for us I and E, inclusive and equitable. So keep that also in mind and add that to our SMART objectives. The logical framework, that's very important. I was going to ask there, but I didn't see cost within that table, even though you talked about cost within your triangle. Let's look at the triangle. Triangle was actually becoming a hexagon, 2 triangles. So there are too many things to consider. I see in future even another triangle. Having said that, all these are pictures. The picture speaks 1,000 words. All these are pictures in our minds. The triangle, that's the triangle of constraints. Then the timeline, you also emphasize that over and over again. We keep that in our minds. We need to be comfortable with what we can achieve. But at the same time, we should stretch ourselves a little, shouldn't we? We still stretch ourselves, even though we want comfort. But at the same time, know yourself and keep the timeline within what you can do. Questions, please. This is so interesting. Except you know it all, you understand everything. Thankfully, we have access to the recording. And also, as Andrew has told us, to his slides. I will definitely save the slides and use them over and over again. And I believe all our entities, all the organizations will really have benefited a lot from this. Yes, I see someone has asked a question. Let me take that quickly. Andrew says, can patient inclusion fit into capacity building in advocacy? Patient inclusion. Can this fit? How do you understand that question? Patient inclusion.
Well, hopefully I can answer it as best as possible. Well, I think beyond a doubt, patients and people living with diseases will always and should always be involved in everything. Nothing about us without us. They have to be involved in any plans or activities. And I think we've seen the negatives of when they're not included. And we've seen a lot of positives from different areas of the world when it's necessary, when it's been happening, and the benefits. And absolutely, advocacy needs to be done with people living with the disease. As much as, and not to call anyone out, but I see Dr. Maureen Achebe is on the call, an amazing doctor in Boston, works in sickle cell disease. And so as much as we have doctors who are experts in the disease topic and can talk about the pathway and continuum of care and what's needed in terms of medical care or resources like that, what's going to matter to decision makers is also that it makes an impact on the people that vote for them, that people that they're dedicated and expect to serve as public servants. And so advocacy should be a mix of not just sharing what resources are needed in terms of achieving goals like health morbidity and health mortality, but also the impact it's going to make on the lives of individuals. And that's why patient advocacy and training should be always done. I've done a lot of those, especially in the areas of HIV. But yes, advocacy has to include everyone, or else it's not going to be effective.
Excellent. Yes, you said it right. The HIV and AIDS community, they're really big on nothing about us without us. Also with disability community. And I mean, they say it in I think it's in Latin, nihil nobis, something nobis. Nothing about it. It's so important that we are part of it. They know where the shoe pinches, so they need to be part of it. So that's a very good question.
I'm not caught up on my Latin, but I'm going to say you're right. That's how it's said in Latin. I'm going to assume that's the way. Yeah.
But I don't say it that way. They go back to the root. So the questions I have here are, can you share some best practices very quickly for building and sustaining strong partnerships with local healthcare professionals or providers, volunteers and donors? The best practices, maybe in one or two.
Sure. Well, I think always the biggest framework for any sort of stakeholder engagement or building partnerships is that discipline and time. You're not going to immediately be able to walk up to an organization and say, okay, here's how we're going to work together. But reality is that you want to make sure that you learn what their strengths are, learn what your strengths are, and how can they be compatible with each other. Because if you go ahead and do the research of, okay, this hospital has these amazing doctors, nurses, and allied health professionals. They have the skill set here. But I've been learning that patients don't want to go there because of XYZ or their stigma or something associated with. And my organization has done a lot of work on stigma reduction. I now can come in and say, like, hey, here's how we can work together. Here's the great ways we can do something together. So preparation for any sort of partnership is key. coming with some ideas as well of what strengths each one have and how they can create something better. Because that's what Gansett's about. That's what these collaborations are all about, is building on everyone's skill set to reach a new higher level.
All
So
right.
I'll say there. Yeah.
Yes,
Oh.
Maureen, thank you. You've said it as it should be said. Nihil de nobis sine nobis. Nothing about us without us.
I know you
But
knew
it's
Latin,
absolutely
Dr. Cheme.
important.
I know you knew
Yeah,
Latin.
that's the importance of patients being there. They know patients advocates and patients need to be there. So I think the polls will be up shortly, but before you leave, the impact of how do we really demonstrate impact? We talked about outcomes, outputs, outcomes, the impact. Is there any one or two things you can leave us with that will help us demonstrate impact of our projects, to our that really resonate with our sponsors or donors or grant providers?
Yeah, and I believe, impact can mean many different things. And, as you work more in a research or academic setting, impact can mean very much like changing morbidity, mortality, seeing changes happening there. That's an impact. I think for organizations that are smaller, newer, focused on different things, impact can mean different things like you interview the caregivers of children with inherited blood disorders who are saying it's easier now for them to access medication. It's easier for them to do things. More anecdotal evidence, but it's also showing changes happening in the lives of people we're trying to serve. So I think the most important thing when it comes to measuring impact, and again, it can be a very methodological process, randomized control trials, all that. Maybe we don't have the capacity for that. The capacity maybe we can have for impact might just be showing that we created change in the lives of people we're trying to see change, and that we're documenting that sort of change happening. So I think the biggest critical thing I would just say is to document everything, show quotes, see the pictures, see the videos, make sure those grantors or organizations willing to sponsor know their money has gone to good use. Yeah.
Fantastic. Document everything, pictures and videos if possible. And then the last question for the day would be this, for this session would be this: will ASH include a session for patients and advocates in the upcoming conference, Andrew?
Well, that is not my area. The ASH meeting is quite large, and it takes a strong team. I know there are opportunities. Yeah, I know there are opportunities for nonprofit organizations to get things like registration waived. I'm happy to share that with Gansett. That can maybe be disseminated. As if we're getting closer to the meeting, it might be tricky now and I can't promise anything at this point, but as always, the ASH meeting every year.
However,
opportunities.
Sorry to butt in. Gansett will be there at ASH.
Yes.
So I think we'll
I was
take
just
care
about to add, yes, Gansett will be there. I look forward to seeing everyone there. And there are side events, side activities that also can be created at the ASH meeting to support. But yeah.
Exactly. And with technology, you can join ASH without being there in person. So all the questions and comments can be received. Yes. Thank you so much, Andrew. We're very grateful to you. This has been wonderful. And thank you for giving us access to your slides also. Please, participants, remember there is a poll that can help us refine this Congress better and better every year. Thank you very much, Gansett. You really mobilized globally and you've mobilized from grassroots upwards for making this resource accessible to all of us. Very expensive resource. I don't know how much we'd pay you normally, Andrew, if we were to pay for this. We couldn't pay. Thank you very much.
I'm happy to do this. Definitely. I'm happy to do this. Yes.
Thank you, Gansett. So Sam, over to you. Thank you very much.
Also, I just wanted to note that these Zoom recordings will be on the Gansett website within a few weeks. And also that Gansett has 8 course modules for patient organizations. And the courses are able to be accessed on the Gansett website. So just keep a lookout for that. And without further ado, thank you everyone for joining. I can't wait to see you in the rest of the other sessions for today. Cheers all.
Beautiful. Cheers. There's a third question. Oh, that one need not have come. I think there's a break.
Yes, we're about done. Next session starts at 8:30 a.m. So looking forward to seeing you.
Somebody was asking that if there's a break, right?
Yes, so we do have a break from now to 8:30. So you have
Super.
enough time to get breakfast and coffee and, do what you need to do. So
Walk
we're about
around a little, walk around a little.
exactly
So
get
let
some
the
fresh air.
get the circulation moving. Thank you, Sam.
Exactly.
Thank
No
you.
problem. Okay, bye all.